Okay. Hi, everybody. Thanks for joining us. I'm going to be showing you Sculptra today. This is Tori. She works in our office, and she's a great patient for Sculptra. So I'm going to get my gloves on and kind of talk about what we're going to do and actually show you. This was pre-recorded just to make the flow easier, but this is actually one of our exam rooms in a real patient. Okay, so with most of us, we start off in our lovely 20s and into our 30s with these nice, full cheeks. What happens as we age is that we lose some of our bone structure, so our cheekbones get thinner, and then we lose some volume in here. And that all causes the face kind of to come down. So Tori, when you bend like this, we get a little bit more laxity here, which we hate. You look down at your phone, you're on a Zoom call, what happened? So what we're gonna do today is we're gonna add a little Sculptra. Now Sculptra is a little bit different product. It's a biostimulator, so it actually creates collagen in the skin. And that gives you some nice volume in through here, and it's gradual. So you usually need about 3 treatments of Sculptra, and we'll do this 3 to 6 weeks apart. So over the course of a few months, it will gradually build your collagen, and you'll see that nice re-volumizing of the face. So you'll get a little bit more plumpness in here. Not too full, it will just gradually fill in where we need it. What it also does, because it does stimulate collagen, is it makes the texture of the skin really nice. So it will just kind of smoothen the texture and some fine lines. Okay, so you ready to get started? Okay, all right. So I don't do much marking. Now Tori's already been cleaned. She doesn't have any makeup on. Tori's one of our estheticians, so this is why her skin looks perfect, okay? None of us just wake up looking like this, but. Okay, so I'm just make one little mark. And for today, what I'm gonna do is I'm just gonna work on this side of the face. Most of the time, I'll kind of go back and forth. Can I have a little alcohol too, Anna? Most of the time, I'll just kind of go back and forth, but we're just gonna do this side today. Okay. No, I got it, thank you. All right. So I've already kind of done an assessment on Tori since I get to see her little gorgeous face every day anyway. Okay, so we'll start back here, kind of work to build where she's lost some volume, and then we'll really move to the center of the face. Now with the Sculptra, we mix it with lidocaine, which helps to numb, and then we also mix it with a little water. So it's a lot of volume that goes into the face. Now what's going to happen then is over the next day or two, all that beautiful volume that we put in is going to go away. So it looks amazing when you're done, but then the volume goes away. And then over the course of the month, 2 months, 3 months, the collagen will build. So at the end of our session today, she'll get an idea of what our goal is going to be with the Sculptra. So this is not for somebody who wants an immediate improvement. This is more for somebody who's going to be able to take some time and have some patience and say, okay, we'll wait and let that collagen fill. We're going to put a little bit back here. This is just to help to create some tension back here to pull back. And you can already probably start to see at home that this is just filling in this nice area. You don't have quite that sharp angle like we did. All right. Again, we did some numbing for Tori ahead of time, so she numbed for about 20 minutes on the face. Sculptra stings just a little bit going in, but it's not too bad. And then as we go along, it gets a lot better because there's some numbing in. And you can already see it's starting to nicely lift and fill in the cheekbone. Okay, good, good. And these little syringes get a little blocked sometimes, so good. Good. All right, so if you take a nice look, we're going to really fill in this hollow here. So if you don't like needles, you can always turn away till we get done. The difference with Sculptra is that you need to massage it also. So you need to massage it 5 times a day for 5 minutes for 5 days. We call it the 5-5-5 rule. Okay. And because we're filling in this hollow, we're also going to be lifting the skin so that when she's going to now have that dreaded, when you look down, she's not going to have this downturn there. And there's places that we use Sculptra and places that we don't use it. Where we're not going to use a Sculptra much is going to be right in the little corner of the mouth. That might be something where we do another type of hyaluronic acid filler just to pick up that last little corner there. So we often combine treatments to get the best results for your skin. There we go. How nicely this is filling her in. She doesn't look too full, but we're getting this volume back in her skin. Great. Okay. Let's work this cheek a little bit more. Doing well, Tori?
Absolutely.
Good. Okay. And really nice bone structure. You know, most of us have nice cheekbones. It just, we lose a little vavoom over time, so we're just trying to get that back. But still look natural. All right. Good, and you can see not much bleeding, just little pinpoints. Pretty comfortable?
Yep.
Good. The chin over time starts to come up, and so we're gonna just kind of relax the chin here. She really doesn't need much hair. A lot of us in our 40s and 50s, 60s, we have a little fold here, and that's normal. So we don't want to totally make it flat because that just looks a little odd. I've got to touch more in that one. Mm-hmm. Okay. And I just have alcohol here. We just keep cleaning the skin just to make sure it looks nice. All right, and then we're reassessing. Good. Gorgeous. Okay. All right, relax for me. We're gonna go just right along this jaw here. Keep that smooth. And can you put just a little 2 drops of dry salt for me? Good. Good. All right. Okay. Thank you. All right, and we can always do just a little drop right here. Okay, 1, 2, 3, push. Good. All right. So that is one side of Sculptra that we've done. You can see pretty easy. And so then what we do is we'll do a little bit of ultrasound gel and just massage it. So we've added quite a bit of volume back here as compared to, you can see the hollowing on the other side. This side was worse than the other. Almost everybody has one side that's a little worse than the other. Might be from where we sleep or a driving side, but we get that evened out over time.